Hi there. For those that don't know me, I'm Dr. Howe. I'm one of the partners here. We thought it would be a good idea to take you around the back of the main bit of Carnoustie Medical Group just to show what we do in the background. So here we are in the main back office. This is one of the things that we spend quite a lot of time doing. We have got lots of insurance reports here from solicitors, benefit agencies, Angus Council, the DVLA, Armed Forces, employers and patients themselves requesting things. So these are notes that we have to deal with on a daily basis. So that's just one part of the work that we do that people may not be aware of. Moving through the surgery here, we have the area where notes come into from the hospital. This is a lot of results that come from the hospital. All these have to be scanned in by the girls and then sent to various doctors to be actioned. So if you have a blood test done for any reason, these come in paper format and then are scanned in and then they go to the doctor. So that's why sometimes results take 2 or 3 days to come in as a bare minimum. Moving around the surgery here, we have got our office girls who are dealing with queries on the phones, dealing with prescriptions, dealing with appointment requests. And moving over here, we have someone that sits here to do the repeat prescription. Now you'll be aware that it takes 48 hours to order a repeat prescription. The reason being is that this is one day's lot of repeat prescription requests. So that is why we ask for 48 hours. We've got a lot of demand on the repeat prescription line. Moving through the rest of the office, we go into where the secretaries live. Now, the secretaries will type referrals that are requested from the doctors. So, for example, if you were needing to see a cardiologist, the doctor would dictate a referral, and we can see Dee here is typing one at the moment. They all go electronically up to the hospital, and then you'll be added to the waiting list. In the back corner here, we have Lynn, who is doing some summarising and coding. That basically means that if you're diagnosed with a chronic disease, for example diabetes, Lynn will ensure that you are recalled for your bloods, blood pressure, and coded correctly so that if you need to go into hospital for any reason, it's in your medical records what your medical conditions are. So this is just a little bit about what goes on in the background, which you may not be aware of, to help you understand how we organise the patient journey. Yes. Moving through towards the front of the building,
yeah, that's no problem at all.
Traditionally this is where the medical notes came. So for the average patient you have paper notes. Now we're completely computerised. These are kept for administration purposes, but everything goes in the computer, which is why if we have a computer glitch sometimes things can be a little bit difficult. Now, most of you will be aware that this is the main reception. We've got Anne on reception at the moment who is dealing with queries, prescriptions and any patients that come into the desk to check in. Moving on through, this is our minor injuries room. Hopefully not many of you have been in here, but this is where we tend to bring patients if they are sick, needing oxygen, needing resuscitated. We have emergency medication here. We also have oxygen and a defibrillator, just in case. So this is where we would tend to bring patients that are sick, but generally to be in the emergency scenario. So that's just a little background of the back offices in Carnoustie Medical Group, and hopefully you find that useful to understand why we do things the way that we do.